Joining us now is Dr. Bruce Ward with the BC Dental Association. Welcome, Dr. Ward.
Thank you.
Thanks for showing up. It's a very interesting, unexpected phenomena. When someone has a heart attack, you don't sort of expect there'll be sort of a dental connection too. But can you walk us through why it would have been so important for Sophie to have, taken care of teeth and been aware of that also?
Sure. Well, for years, people have tended to separate the health of the mouth with the health of the rest of the body. They kind of figured the mouth was one thing and the body was another. It's just been in the last few years that people are really starting to see, researchers, physicians, dentists are starting to see that there is a connection between the health of your mouth and the health of the rest of your body. That certain things show up in your mouth when there's conditions in the rest of your body that kind of are a consequence of the physical conditions that you might be going through, like heart disease or diabetes, have oral manifestations.
Well, the diabetes is a really good example, and it makes me think, are there other examples? Like, how precise is the connection between issues, oral issues, teeth, gums, and other diseases?
Well, there's some direct connections. One of the most interesting ones that I just found out about recently was the fact that in people who have infected gums, particularly as they get older and they may be in a long-term care facility, the bacteria that causes pneumonia is in their gums. Yeah.
So obviously, really good oral health is crucial to overall health.
It's huge.
Oh,
it's huge.
What do I do then? What do you do for good oral health?
Well, the good news is that good oral health is a pretty easy thing to obtain. You can start a regime of oral health care on your own, but usually better to do it under the care of a dentist.
Does it have to be a dentist? Can't I kind of cut some corners and...
Well, dentists are kind of like the doctors of the mouth. We specialize in the mouth. So you have kidney specialists, eye specialists. We're oral specialists, and that's what we do. So if you want a complete assessment of everything that's going on in your mouth, dentist is usually the place to go first.
How often would I have to get an exam to make sure that my overall health was being...
At least once a year. At least once a year, just to make sure that things aren't falling apart. Things happen slowly in the mouth, but every once in a while something can occur quite quickly. If there's another body condition that comes along that causes inflamed gums or causes the gums to become infected or that kind of thing, it needs to be picked up. But if you go at least once a year, you'll probably be fine. It
sounds as though there's a lot of impetus is just put on someone saying, I want to have good health, I'm going to follow through with this. Is there some kind of a synergy where you can work out a plan with the dentist to make sure?
Absolutely. That's the whole point, is developing a relationship with a dentist that actually serves you, because as a patient, you don't know. The interesting thing is, if we had a condition on our body, like let's say your hand bled every time you shake hands with somebody, you'd go see a doctor about it right away. And yet, we're willing to put up with our gums bleeding for years in some cases, just because we don't really consider it an important thing.
So literally, do you think you could avoid heart attacks or avoid...
That's not clear, no, that's not clear. If you have infected gums, you shouldn't be going to see a cardiologist right away. But there is some... Heart disease is a disease of inflammation. That's what, it's not bacteria necessarily, but it's a disease in the body caused by inflammation. And when you have inflamed gums, that adds more of a load of inflammation into your whole system. So it's a good idea to clean your mouth up first so you can start to clean your body up.
So really it's like an opportunity for a wonderful red flag to say, take a look now.
Yes, and it's easy to do, and it's easy to do with the right instruction. You can do it yourself, and you can really turn your oral health around.
Wow.
Yeah.
Dr. Bruce Ward, thank you very much.
Thanks.